My name is Rhonda Worthy. Your life can change within moments. You could be in the kitchen cutting vegetables, or you can be riding a bike and you fall and scrape your knee, or you cut yourself. Then all of a sudden you start experiencing back pain, severe back pain, or fatigue, nauseousness. This can be the beginning of a bone disease called osteomyelitis. The mental and physical pain endured from this disease can be very severe or detrimental to your bones, or overbearing if not caught earlier. I am going to inform you about this disease, osteomyelitis, in 3 steps. First, I'm going to tell you what it is. Second, I'm going to tell you the symptoms. And third, I'm going to tell you the treatment. But first, I'm going to explain what osteomyelitis is. Osteomyelitis is a bacterial fungal infection that has entered the bloodstream. It affects your bone. It is usually caused by an infection called Staphylococcus, which is entered if you have a wound or a cut or a scrape. There are 2 types of stages in osteomyelitis. One is chronic and the second one is acute. Chronic osteomyelitis is more severe and can affect you faster than acute. So if it's not detected earlier, then you're not hospitalized, then it could be very difficult and overbearing, the pain and affecting you, your whole body. Acute is more fungal or small scrape that hasn't entered the bloodstream yet. So you can detect it quick and get treated for it. Now that I have told you a little bit about what osteomyelitis is, I am now going to tell you the symptoms. Usually you will feel, like I said, severe back pain, irritability, fever, swelling of the affected area, and redness. And usually it's 2 out of 10,000 people that will get this disease, so it's rare, that's why it's unknown. People that do get it more are people that have osteoporosis, people that have sickle cell, kidney failure because they have already an open wound or their body is weaker, so it's easier to enter the bloodstream if it's not detected early. And furthermore, for treatment, first you would have to get an MRI done or a bone scan, because that's how the doctors can tell you what stage it is, if it's chronic or acute. So you would want to get a bone scan and you would want to do an MRI or a biopsy. After that, then they can go by treating you. So if you have chronic osteomyelitis, then you might have to have surgery or several surgeries. And it can last within weeks. You can get it within weeks and it can last for weeks or months, depending on the stage. After you have your surgeries, you will usually have to be on antibiotics right after surgery and hospitalized. Then after you get out of the hospital, you will still have to be on antibiotics for a while, usually a month. For acute, if you have a stage 2 after they do the x-rays, then usually the doctors can send you home and you can take antibiotics from home. So that means it hasn't entered your bloodstream and it hasn't affected you as bad as chronic. So you caught it. Lastly, now that I've informed you about what osteomyelitis is and how it can affect you and treatment and symptoms, just want to inform you again that it is a rare disease and that 2 out of 10,000 again people get it. So it is good to be informed if you're informed about it and get checkups. And yeah, I think that's it. Thank you.
Well, thank you.
Thank you. Wait to the camera.
Yeah, it was good, baby.
Yeah.
I know that's why you picked it, because your daddy, huh?
I never knew